Sometimes I will be looking into camera like a talk show, but only with one performer. Actually, this is a lecture. It will take around 1 hour, after which we will be able to talk a little bit. I'll be happy to entertain your questions. And sorry for turning my back to some of you sometimes. I'm going to try to walk in circles. So, today I'm going to speak about how a doctor would be recovering from sickness, the little tricks of big healthcare. First of all, I suggest that you watch a small video. It is medical shock content, I would say. Do we have sound or not? Should I report to you how I am treating a patient? What do you understand? How can you talk to me like that? I will talk to you as I want, because I am an elderly person. I can be your grandmother. What do you need from me? Go away. Go away from here right now. Are you going to take me as a patient? No. Are you going to have me for a visit? No. He's beating me. He bit me in the eye. Can you imagine that? Go away. Police will come right now. Go away. We're going to deal with it in the police. I need insulin. You can die here. I don't care. I will not give it to you. It's good that I have my phone recording all that. I need medicines, and I don't. I have 3 universities. I have parents who have put aside 1.5 million rubles. You don't have the right of taking me here. I am going to work here until 70 years of age. Let me alone. You're going to lead me to stroke. So, I think that no one has any doubts that today our healthcare is not at its best. This is the video that over the last few years has become quite popular, and we can see a lot of such videos on YouTube. We've heard a lot of stories about a doctor beating a patient beating a doctor suing a patient, and vice versa. This is an endless story, and perhaps something is wrong. Perhaps we can say that our healthcare is ill today. And this is actually very scary. When I was editing this little piece of videos, I felt very awkward, and there were some videos that I decided not to add in this big video because it was just too scary. And I felt as a child whose parents are fighting, and you want to tell them, stop it, why are you doing that? We have enough external enemies. Patients should not fight with doctors. Instead, they should try to just get together. Of course, resolving medical issues is a huge task, and it's not our goal as of patients to try to do something about that. It will take years to resolve those issues. We are living, but someone is dying. You know who it is, right? It is Andrei Pavlenko, a prominent cancer specialist that died on the 5th of January. And before that, he was talking about his disease. He's a cancer doctor who throughout his life was treating stomach cancer. Then he got stomach cancer himself and died after 2 years. So his goal was to treat patients, and he has all the possibilities apparently ahead of him. But what does it mean? It means that we have such a huge common enemy in spite of the progress of medicine. We are still dying of diseases, and in this situation we cannot allow ourselves to fight. We should get together.
But we fail to do this, and what can I advise to you? What can I advise to patients? It's to be treated as physicians. Of course, there are some diseases which cannot be treated at all, but still, if it's possible, in this case, you can do this. You should try to treat it. What do I have? My name is Olga Kashubina. I graduated from the medical university. I worked as as a general practitioner, but I did not work for a long time as a general practitioner. But I can speak as patients and as physicians. I feel now more like a patient, not as a physician. And my practical work is dedicated to take side of patients, because there are two groups of people. They are separated by this, a physician's uniform, a white gown. That's why I try to bridge this gap. I have the blog about medicine, and also I develop media. So I have postcard which is called Only to Ask. And then I even wrote a book. In this book, I tried to sum up all this experience regarding patients. And I hope that, I think that this book is really useful for all patients who want to be treated like physicians, to have all these possibilities, to have be treated as a physician. You should not have the medical background for this. But what is it to be treated like a physician? But we speak about good physicians, of course, because you know some examples of bad physicians, and sometimes they don't treat themselves as well. They don't like to go to, outpatient clinics, hospitals, but we speak only about good physicians. So let's speak about them. First of all, they don't treat themselves, because if he's good enough, he will not be so confident in himself to take responsibility of treating himself. We don't speak about cold, of course, or chronic pain in the back when everything is clear from the beginning, but at that, 63% of us prefer to treat ourselves, with the exception of something really critical. And 63%, this is a lot. Other researchers show that physicians are still more efficient than people, ordinary people. So there was the research. There was the program where you could type in your symptoms and then you could see the answer. And physicians were right in 72% of cases, and patients only in 32%. So physicians still win. AI is genius, but still it can't even win over physicians. That's why please trust more physicians than internet. Also, the browser story of patients demonstrate that they try to be treated in 2 weeks before extreme hospitalization. So people Googled a lot, and then he had to call emergency crew, and then he had to go to hospital. Maybe it would be better for him just to do this in advance. But it means also that all this Google search was in vain, and it did not lead to any result. So you can see this in the picture, this patient who is trying to make a diagnosis for himself. And another argument of physicians why they go to other doctors when they are ill, because it's very subjective. So you think you have one disease, but you can perceive this in your own way. That's why even physicians always go to other physicians to have additional opinions. So there are conclusions. So don't try to treat yourself. Of course, if this is not a cold, which you also can treat without any physicians. Then let's go further. Of course, you go to a physician, but where can you find this good physician? Because physicians know well where they can find good physicians. So they have this information. What should we do? What are criteria of good physicians? Here we have a lot of opportunities how to choose specialists. You can go to the private or public clinics. But sometimes patients without any medical background should say who is better. But this is quite abstract. So we can evaluate the status of physicians, where he works, his maybe degrees, whether he has PhD, or maybe location of work, is it prestigious, his hospital, then internet response. But all this information shows that this is quite subjective. And it doesn't give us an exact answer which specialist is good and which one is not so good, because everything in the world can be quite formal. Even PhD thesis can be formal, and his place of work maybe because of his good friends, and sometimes even internet responses can be done. By these physicians themselves. That's why it's better to have responses of other physicians. If you have one physician you trust, ask him about his colleagues. If you know this good physician, that he's good, he will not lie to you. He will recommend a good colleague whom he believes and to whom he himself would come to him. Because physicians also want to have more good specialists, and also physicians can recommend you some colleagues without which is not so known. Maybe it's quite a modest guy, but he can work mirrors, and this is the difference. That's why one good contact, if you have it, it can give you more than the whole internet, because this physician can become your starting point into the world of where everything is solved by but real opinions. And always ask your doctor why he recommends this person. Maybe this physician treated his relatives, maybe his classmate. So you have to have this database of good specialists, good physicians, because in our unstable world, it's your, also. It's your thing to have this good doctors. When you come to your physician, please, of course, I don't say to you that you should, tell him, give me a list of all physicians of different types. But if you, in the case, if you really need a good physician, please be responsible for this and try to consult your physician, good physician whom you know. Because I know that Ministry of Healthcare also tried to create a list ratings of physicians, but nothing happened. Because there were a lot of intrigues and they could not create an objective rating. That's why they had to solve everything not formally. What else good doctors do? They know how to evaluate quality of work to whom they came post factum. So you come to this doctor and you should understand whether you have a good contact with him or compliance. Can you cooperate with him? And are you on one page? And also, you have to understand what quality of this medical help is. How can we define whether this physician professional or not? This Dr. House who can synthesize information very well, analyze it, and he can build up a real scheme which could be individual. But this is not all, because a good physician means also skills. But skills, these are not these hands, golden physician, golden hands, a surgeon. But also it means communication, as this skill of communication. And unfortunately, very often we under-evaluate this, and our physicians don't have it very often. So you should understand how to do this. When you have this first contact, you can evaluate his so communication skills, and then the rest. Do you know how much time do modern students, medical students, spend on communication skills? It's one semester of the first course, and this. So this communication training is nonsense, because then students communicate with patients as it is accepted in this medical healthcare. And sometimes patients are rude, manipulate patients, and they think that this is right. But if it's a good team of physicians, this physician can become a psychologist even. And you should know that there is no systematic education on communication skills for physicians, because abroad this is a medical discipline in medical universities, because it doesn't depend on the character of physicians. That's the same discipline as to know how to analyze ECG. You should also learn this from book, and abroad these physicians also have trainings with some actors who can act differently in different situations. But we have separate books, we have courses, but usually this is the initiative of physicians or chief physicians. This is, we don't have the systematic education. What happens when there is no communication? Patient cannot get trust, and also patients cannot follow recommendations. You just look at the list of medications, and you think that I will not consume this or that. And what happens then? The plan of treatment becomes in a different way, and if treatment doesn't help, physicians can see that it's not efficient, and nothing helps, and with time patient loses interest towards these patients, because physicians like to cure patients, and if it doesn't work, physicians also can lose interest, and patients get disappointed in medical help, and if even physician is smart and set a good diagnosis, but in spite of this, still communication was bad, and nothing happened. Patient is not cured, and that's very bad. And what is the most horrible in the situation? You saw this in my video. Patients never give a feedback. For example, if a physician is rude with patients, patients will never come back, and physicians will never know that he cannot communicate. He just will see that patients don't come back. Maybe something happened. So without this feedback, physicians are sure that they are good, and many years pass, and physicians are not efficient. Besides, there are burnout physicians, and unfortunately, it's a bad situation, and everybody can get into this situation. We speak about psychological disorder. this burnout thing, and this is also a diagnosis. And if you come to this burnout physician, tired, exhausted from his work, and he become really very indifferent, totally indifferent, your chances are equals to zero. Also, what you can do, you can leave this physician quickly. Don't try to build this communication. Please change this specialist, because you should run away from him. How can we know that this is a burnout physician? Here you can see a list of different symptoms of professional burnout. This is a very serious disease in our medicine, because we don't have these positions as psychologists at hospitals. And the psychologist can do something for this. For example, can work with burnout physicians. Our physicians are burnout for many years, and they treat treat people. But maybe this treatment is not really efficient. You have a lot of screens, you can see these symptoms. And what can we understand here? If you come to a physician and you have this feeling that you are guilty. You are guilty that you got ill. You are guilty that you have come. You are guilty that you haven't come earlier. And it doesn't matter what diagnosis do you have. Maybe it's trauma, injury, or maybe something else. But if you feel uncomfortable and guilty all the time while you are communicating with this doctor, please leave, because there is no way to engage this burnout physician, not at your level, not at patient's level. That's not your thing, because now this physician cannot do anything good for you. Sometimes, of course, maybe in the village, it's the only person who can help you. But in the majority of cases, please try not to think that this is so that you are to blame, and don't think that his aggression, hidden aggression, is serious. So this is also the disease of our healthcare system. What about good physician? How does he look like? This is the physician to whom you come, and some patients say that after even communication with him, you feel better. And you feel some certainty that even if this patient has a serious illness, still this patient understands that that there is something to do with it, that we can work at it, and this is a good thing. So in this case, you can develop trust towards this physician. Even if you ruin something, in his prescriptions, still you can be honest with him. And finally, knowledge what you can check after you come back, and this is critical, because every person information. So 70,000 people are trying to find information in Google, and in Yandex 5,000 people. Even now, people are trying to look for information in the internet. We recheck all information in the internet. That's normal. That's okay. Internet is the first source of medical information for people, and it will be only developed. But here you should understand that more than 40% of people in Russia, this is December 2019, don't trust the diagnosis, and they always recheck diagnosis. But that 42% of people also Google and try recheck this information, because they don't really trust, even if they trust this physician. And this is also a good way to clarify whether your physician was right. But there is the problem. Almost 60% of people don't discuss this with their physician. So they do this work on internet in parallel, and this is quite bad. Maybe you should, so you should speak with your physician about this, even if you found something, in internet, and so your physician says something differently, I think you should say this to your physician. And physicians are not against your education in medical sphere as well, and physicians can also explain to you maybe why this information is irrelevant sometimes, because very often it happens like this. So a patient tries to Google something, and so if you type in a symptom, in internet, you will have a lot of articles dedicated to cancer or very scary diagnosis. It leads to some bad feelings. Because you want to clarify something in internet, and then we are really depressed because of this information.
It is just related to the abundance of medical information that, of course, leads to hypochondria. So how to Google correctly, how to check how good the doctor is and get some safe information. Here it's like in the world of cuisine. First of all, you should assess the quality of every article. You should check it as though, as in case of food, you should check who wrote this article as well as who cooked your meal. You should also see the best before date in case of products, and you should also look at the date of the article. You should also assess the quality of a website on which the article is published, because it may be a scientific website or a website selling food supplements. And also you should create your library of trusted sources, because usually good patients have 5 or 10 good websites and they trust only those sites. The patient Googles just on these websites that are safe. Unfortunately, such websites are not yet available in Russian, but they are getting more numerous. If you know English, it's a bit easier for you, but also a bit difficult because there are many more websites in English. However, you should gradually develop those safe paths and use only websites you can trust. And we know the saying, golden hands of a doctor or genius surgeon. It's all very good, but we should understand that even if your relatives have very good experience with some doctor and recommend you this doctor, you should understand that if you put the doctor too high for his manual skills, you will never know what's happened. Even if you have had appendectomy and your suture looks very well, you still don't know what happened inside, whether he did everything correctly inside you. What's also important in medicine is that after doesn't mean before, because of. So quite often, in spite of the bad treatment, regenerative functions of the organism prevail and you feel still better, and vice versa. Sometimes, in spite of the efforts of doctors, the disease prevails. And there is forensic medicine that is trying to understand whether the doctor was to blame or the case was just hopeless. It's all very difficult, so you should just try to assess the doctor based on his communication, based on the recommendations, and so on. And of course, it's important to make reviews about the work of the doctors. That's like currency for the doctors themselves and for the patients who don't have the possibility of finding a doctor by recommendation. So you can write on various sources explaining your case. If you have forces for a doctor, it will be a good gratitude. If the doctor was bad, that will be a punishment for him, because other patients will not go to him. What else is important? It's important to establish the relations with the doctor, even with a bad one, because if this person will determine how your life will go on, you should still try to make sure you please to the doctor, because loyalty of the doctor to a specific patient will determine a lot of things. Because if the doctor doesn't like you, of course he will still follow the Hippocrates oath, but you will agree with me that it will be easier for both of you if the doctor likes you. So who is the doctor? He is an alien in a white coat. We don't know how interact with him, and to understand him you need to imagine yourself in his skin. What's a regular day of a doctor? These are same patients, one after another. It's very difficult to distinguish them. And quite often patients make it more complicated. They are not being adequate. And every time a patient enters to the doctor's office, for a doctor it's a kind of a surprise. And this patient will be adequate either or non-adequate. So you should make sure he understands you're adequate. How to do that? First of all, be proactive, then be nice, and also remain in the memory of the doctor. Speaking about proactivity, being proactive is take into account that in Russia there are challenging conditions of doctors seeing patients, because they don't have a lot of time. You should not try to make the doctors work, of course, but you should try to be comfortable to work with. For example, pilots are often using checklists to see if everything's right. So if you are allergic to antibiotics, if you don't understand what the doctor has said, it's better to ask or tell that than to do everything wrong later, or allow a situation in which the doctor forgot about an important particularity. Then also speak about your expectations. You might think that doctors will understand by themselves what you want, but patients are very different, and the doctor doesn't understand whether you just came for a sick leave, or you are in pain, or you want something else to be cured. The doctor uses his own expectations, and it may happen that your expectations do not match. So you can just explain to the doctor why you came. You can not just list your symptoms, but try to explain what you want. What is the biggest concern for you? The fact that you have to leave to go to vacation a couple of days, or you want to continue working, or on the contrary, or you want a radical treatment such as surgery, or you prefer conservative treatment. You should talk about all that, and it's good if you make the doctor understand what you want. Ask practical questions. You shouldn't ask doctor, am I going to die? He will answer, yes, we are all going to die. But try to ask important details for you. If the doctor prescribes you some treatment, you can ask him why every medicine is needed. Are there any synonyms of these medicines, but cheaper if you need it? Or are there any medicines that you may not take because they are auxiliary? Or if the doctor prescribes a costly examination, you may ask what will be the result of this examination. What will be the impact of this examination upon the diagnosis? For example, patients often ask to have an MRI because they think that this MRI will show something to the doctor in case of back pains, but in 80% of cases the MRI will yield no information to the doctor at all. So you should formulate well and ask questions. If you suffer from a serious disease, you may go to the websites dedicated to the disease or to the patient communities, because any additional information taken from the doctor can help you a lot, and then you will not have to Google afterwards. Consider various ways of treatment, and you may ask the doctor if there is an alternative. For example, doctor, you are sending me to surgery, but maybe there is another way The doctor may not have an idea about your income level and not understand how serious it is for you. Or maybe you are ready to go abroad to treat this disease, or you are willing to try some experimental ways. So your goal is to ask all that and help the doctor to do the correct choice together with you. So always ask the doctor what are the advantages and disadvantages of every scenario offered. For example, in this situation, I will have a surgery, it will be good, but I will need rehabilitation. What about a conservative scenario? So involve the doctor into the decision making, because patients are trying to shift this responsibility upon the doctor. And often they are not happy with the result. And then tell the truth and be ready to listen to the truth. It's not always pleasant and easy. It's not always easy to say something personal about yourself to the doctor. And many patients don't want to hear the truth or set forecasts, but it is important because this creates trust. And if you show to the doctor that you're adequate, that you want to learn things, he will be more willing to tell you the truth himself. For example, he may say, I'm not yet sure about the diagnosis, I prefer to observe for a little while. So please be patients who cooperate with the doctors, and also be nice. Who's an ideal patient for the doctor? I asked this question to my doctor friends, and they answered, well, please don't publish it anywhere, because I understand that I have to treat all the patients without taking into account their individual characteristics, but still, doctors want a number of things from patients. They have a list of wishes. It doesn't mean that you have to match these expectations, but still, it is easier to be a nicer patient. So what do doctors want? They want patients to be polite, to come on time. On the one hand, they want them to be not too serious, not panicking, not requiring to immediately cure him, but on the other hand, not too relaxed, be able to listen, not trying to seem to be smarter. Of course, no one likes it when someone is trying to teach you something, and quite often there are patients who are coming to the doctor and saying, you know, I've Googled everything and I think that it should be done like this and like this. Of course, doctors are quite annoyed with that, as in case of other professions. But unfortunately, in contrast to other services, the doctors cannot just refuse to treat you, but they will be irritated. So please restrain your intelligence and knowledge. Of course, you may say that you read something online, but please be tactical. Now, positivity. Many patients go to the doctor and start complaining about the healthcare system. And it's difficult for doctors to listen to that because they know the situation better than you do. So if you came to the doctor and if you want to be treated, to trust him and get cured, you should take that into account. Why it's important to have recommendations about doctors. A blogger I know told me an interesting story when I asked her, why you, being a doctor, have a blog about medicine? Do you want money or fame? She answered, no, I want patients to get educated and understand that we match each other and come to me because I'm very high in demand and I'm tired of inadequate patients. And I hope that my readers and their relatives will come to me. They will be adequate and then I will be happy because there will be less inadequate patients. And this is serious for doctors because it's easy to work with good patients, difficult to work with inadequate patients. How to thank a doctor and why doing that? Well, of course, the doctor has no right to require any recompense from you because it's their it's just their profession. But maybe many are afraid of some informal gifts to the doctor. But I believe that if you really want to make a gift to the doctor because you are very grateful, you can offer him something. It may be money, but remember about the legislation. If the doctor is a public civil servant, he will be prohibited from that. Or you may just ask the doctor, tell him, I want to thank you financially. If he disagrees, it's fine. If he agrees, maybe that's a good way to proceed, especially if you felt that the doctor made much more things that was formally needed. And if you really want to thank the doctor, such gifts will remain in the memory of the doctor. But please be careful about personal gifts, because doctors are telling stories about strange things that they were given. So perhaps it is better to just give money. Amounts less than 3,000 rubles are maybe considered as a gift in the situation when the doctor doesn't take the decision. I'm not going to give you advice, but just know that on the one hand it is normal, on the other hand it's not mandatory. But when the doctor requires money from you directly, that's an infringement of law, and you can complain about that, because sometimes there are situations when the patient dies and the doctor says, I will make a surgery only if you pay. In that case, the patient is not considered as a participant of crime, and the patient can sue the doctor in this case. So what is the conclusion? Please be careful towards doctors. There are few doctors. Doctors are living medicine. Producing new doctors, it's costly and it is a slow process. So try to make the life of the doctor easier when he sees you. Thus, you will earn his trust and gratitude. Doctors love adequate patients. But remember that your health is first. So you shouldn't do things uncomfortable for you if you think that they're comfortable for the doctor. Your life is the most important thing. Remember also that you have the possibility of changing the doctor if you need that. I read yesterday that a Russian spends on purchasing medicines in the pharmacy around 10,000 rubles per year. That's a lot, and serious, taking into account that pharmacy is not a safe place. Pharmacy is like a labyrinth. It may look like a supermarket, which is quite pleasant, where you can buy something and feel better, but actually it's a dangerous place. And there are a lot of dangers there. Here are the 5 rules of safety in the pharmacy that will perhaps allow you not to spend extra money, buy better medicines, and evaluate once again the work of the doctor. First, don't buy medicines according to your ideas. You need a good doctor for good prescriptions. You cannot just ask the pharmacist. Well, of course you can, but the result will be unpredictable. So it's better to start your visit in the pharmacy with some justification. Don't come in the pharmacy if you are healthy. If you are sick, go to the pharmacy or send someone, because if you buy medicines just in case, it will probably be unnecessary, and you may become hypochondriacs if you go to the pharmacy without reason. Believe me that in the pharmacy there are merchandisers. There is the so-called golden shelf in the pharmacy around the cashier's office, where they have the most expensive drugs. And also pharmacies are not interested in curing people, they are interested in earning money. So you have to be very cautious there. Another important point: if you doubt in the efficiency of some drug, get a second opinion of the doctor. This is serious issues. This is the list of the most sold medicines in the Russian pharmacies. In red, you can see the so-called pseudo-medicines, that is to say, medicines without proven clinical efficiency, and they are best sellers in Russia. What does it mean without proven clinical efficiency? First, this means that the big and well-organized studies showed that the efficiency of those medicines is not greater than placebo, or that there has been no studies. Unfortunately, many medicines produced in Russia haven't been studied, so we don't know how they work or if they work at all. Taking into account that some of these medicines were issued many years ago and do not exist in the West, that triggers suspicion. So why do we need to know that? If in your prescription you can see only pseudo-medicines, that is to say, medicines that are not part of clinical recommendations, something is wrong with the doctor. Maybe the diagnosis was good, but why does he prescribe homeopathy or supplements and so on? This may reduce the ranking of the doctor in your eyes. And you may ask this question to the doctor. If you have time to read about the medicines that were prescribed to you and you see pseudo-medicines there, that's an occasion to seek second opinion. How to identify pseudo-medicine? Well, actually, ideally, it's the doctor who should know this information. But you can guess that something is wrong if you Google the list of those pseudo-medicines. You can just Google it and have it at hand. That was done by Nikita Zhukov from St. Petersburg, and he did all the work of checking and created this list of doubtful drugs. There are some errors there as well, so this is just something to use. But still, if you find it, you may double check. Another source is the reference book of the formulary committee. And there is point 5 there that shows whether there is enough evidence of the efficiency of this medicine. There are also sources such as Medscape and Up-to-Date. You can find there the International Non-Proprietary Name, or INN, and see if someone in the world, apart from your doctor, is prescribing this medicine.
And also PubMed, this is the largest database. Here you can see whether there were some clinical trials of this medication. This is in English, and clinical trials are not translated in English, and there are no such clinical trials. Such medications without clinical trials, because if we have this medication at the market, it means there will be some information about it. There are a lot of other new medications, and nevertheless, if you can see that your medication fits for medicine, this is a reason to think about physicians. Don't be afraid of generics, because now we have this opinion that a patient gets bad medications, generics, and that it can act worse than the original. There is a so-called generic phobia. People are afraid that these medications work less, but this is the molecule diflofenac, and it can help you if it's an ointment to release this pain in joints. And you can see several medications: Voltaren, Orthofen, and Acofen. They have the same agent, main agent. So all clinical trials were conducted, and their medication costs much more. But when their patent expired, other companies also started to use these medications. And if you can save on medications, why not to do this? But there are many lists of cheap analogs of expensive medications, and we can see that there is expensive Noshpa and a cheap Dartaverine. We should understand this well, because there can be the difference, and also because of the legislation, we don't so generic coincides with a regional medication with its agent, but other substances can be different. And there are graphs which shows how medication can be absorbed and how it can be dissolved, and the graphs can be similar. In the situation, you can buy generics, and again, you can ask physicians about these medications. Maybe he can recommend you cheaper medications. Maybe physicians try to prescribe you only the best ones, but you can ask for a cheaper version. And also yourself, you can do this. In Russia, unfortunately, we cannot a list of good generics. They are not checked for therapeutic equivalency. They are only checked for agent and acting agent, but the real research is when generics should be coincided with original medications. So there is Orange Book made by FDA. And there are many names of the medications, and there can be a whole list of generics and trademarks which produce such medications. Also, there we have indexes, and you can look at this. If it starts with A, this code, everything is good, and these medications went through all checks. If you have an antidepressant and there are 10 trademarks of this antidepressant, you can find this generic and buy this generic, a good one. It's complicated, but still I have a brief recommendation to you. Ask a physician what to do, because, for example, you can say, I want something cheaper. Can you recommend it? But physician can say to you, this is antibiotic, and here it's important that it's not a generic, because we have to be treated quickly, and you can save on other medications, but these medications, antibiotics, should be original because it's better than generic. So in this case, you can speak with the physician about this. But also, I don't be afraid of generics. Check them, but please be afraid of, additives, additive supplements. And how are supplements different from medications? Supplements. I googled this myself. This is a primitive substance which is not registered as a medication but is a food supplement. It's food and you can't take it seriously. But now you know that supplements are very popular. There is a list of the most popular supplements. I even ignore that people consume vitamins, but this highlighted by red circle, these are quite doubtful supplements, and they are quite suspicious, but 20% of people buy them. And this is quite a serious thing, so we have these problems with supplements. But you can say our grandmas consumed herbs. This is people's medicine. Why are you afraid of supplements? Herbs helped. You can say, but so herbs usually folk medicine, but now they are combined with some other substances. Pharmacists pharmacists also use supplements as medications. For example, if supplement emerge, they can turn this into medication. And if supplement stay a supplement for a long time, it's not so good. It means that it's not efficient. And also you can ask your physician about it. And you have to understand why you pay for this. And then the last thing. So you remember that in each pharmacy there is such a writing, dear buyer, medication cannot be exchanged, but you have the right to do something about this. If there is no shelf life on medication or it's expired, you can give it back. And there are also leaflets which describe medications, and we have a lot of faked, falsified tablets. If a description mismatch medications, in this case, you can check this twice, and you can give it back to the pharmacy. Then in Russia we have labs which cooperate with Roszdravnadzor, and you can submit their medication, and it's free. So if you, for many months, you consume one medication for one brand, everything was good, but out of blue on one medication, so the effect stopped to be here. So please take it seriously, because it can be falsified medication, or the factory also made a mistake. And now you have the right to give it back to the lab. And also, again, you can Google labs which cooperate with Roszdravnadzor, and they take this medication for 1 month. They take a benchmarking tablet, and they compare this with chemical. They compare this chemical ingredients. Maybe this can be falsified or a mistake. In some situations, when medications are expensive, this can be like this. In this case, medications can be revoked from the market. So recipe number five, pharmacy is your enemy. So we can check mobile phone for 1 week, for the whole week. We check all things in betweens and outs. But in pharmacy, we can buy any medication which the pharmacist advises us. It should be more serious. And now let's speak about our rights. So doctors whom I know tell me that when you speak about patients' rights, you make some manipulators out of them who try to find some violations in physicians' work. And physicians are afraid that someone name patients customers. This can be wrong, but patients are customers. Medical services are the same services as in other spheres. That's why you have this consumer right to to demand fulfillment of the services, but this is not bad. I think this formalizes our relationships. In this case, you fight the system, not a particular doctor. So if your rights are violated, so it's enough for you to say in in a low voice that there are laws which protect you, and if you don't have relationships with your physician, somebody will hear you, and these people know laws. And moreover, when you stand on your ground, sometimes they make you give tests on your account. For example, our equipment is broken. So when you go against the system, you should know all your rights, and you can call insurance company. So every time when you see these things, you do well. And if you have a rude doctor who and you are patient with him, in this case, so he will continue to behave like this, and it's bad. You try to see that your rights are not violated, and if your rights are violated, inform people who are responsible for this. But you should do this in a calm way. The calmest patients are lawyers. They come to a doctor and say, yes, of course, doctor. They never panic because they know their rights very well, and they know what doctors can do, what they can't. For example, if mom is sad that she cannot be hospitalized with a kid because they don't have seats, vacant places, it's also violation, and you should go to a chief doctor, and then you can find the decision. We should push this from the bottom, and then on the top someone can see, and we feel uncomfortable very often. Now, December statistics, it is said that the majority of patients, in case of errors, but there is no such a legal notion on a definition. So as soon as patients are in difficult situations, they should go to the prosecutor's office and also uses criminal mechanisms. So if we speak about state medicine, public medicine, it's not interested in conflicts. And here different things can be involved. And moreover, so insurance companies have insurance reps, people who are responsible for receiving calls. No, not all people know about this. The first place where you should call. If you are hurt in the hospital, a chief doctor doesn't want to contact with you. You just have your insurance company number. You call there, and the insurance company gets money, and they don't want to have your condition worsened. And many problems are now solved at this stage. Don't go to the prosecutor's office immediately, because not everybody is ready to go to the prosecutor's office. And others just stress, cry at home, and nobody will know that they are hurt, but they have the rights. So what rights do we have? So free help. All citizens of our country, even not citizens of our country, have the right for this. If you are said we can't help you and your situation is not a super rare disease, your rights are violated. So if they have to pay if they make you pay for something which is free, that means that your rights are violated. So if doctors are rude, you can write this on the dictaphone. You can go to a chief doctor and then to the insurance company, because doctors cannot be rude with you. Also, quick response. There is planned help. So CT, MRI, should be here, and all they are covered by state guarantee program. And here you can see what analysis, what time takes. And this is not your problem that there are no labs, that doctors are hired a fight. So your task is not to wait for 1 year when you will have a free test. If this service is covered by insurance company, and then emergency help. Within 20 minutes, emergency service should come to you, or 22 hours. But again, you should not die. You call 5 times emergency. You can also call to the police, because this is already the criminal case. They don't render help. Everything is here, but sometimes we don't know about this. The choice of the medical education, all so we can choose any hospital. But many hospitals in Moscow can accept you with insurance policies. So that's not true that you can say that you can be treated in a certain place and there is covered by insurance company, but not always. You should not think about whether this hospital is so good or not. And maybe there are not so good repair works, but there are excellent specialists. But you can change a doctor, even in outpatient clinic. You can go to other specialists. We have many rights, and we don't know about this. We have right for painkillers, and now these painkillers can be prescribed by even general practitioners. So you should not tolerate pain. That's illegal. Medicine, when if it can help, it should help. So then the right to be with close people, relatives. So since 2016, you can go to the emergency room. If you are not officially married with your husband, and if you have a parent, mom, and she can't understand all this, and a physician should not tell you her diagnosis, but there is the document that you are the med rep of this person, of your mom. It can open all your doors. Even if you are not relatives, you can disclose all information. You can decide solve for him everything. So you should be flexible in our not simple situation, and that's not all.
As soon as you start speaking in the language of rights and not emotional language, it all starts to be an interesting game and not something related to too stressful. You should be literate. And now, recipe number 6, federal law on the basics of the healthcare in Russia. That's your best friend, actually. Law number 323. It's an interesting law. It's quite long, but it's written in a good language. But when you read it, you will feel better. When you come to a hospital, you are not going to feel as someone who has no rights in this place, because this should not be the case. You are the person for whom this was built. You are the patient and you have rights. And everyone who surrounds you is working for you. And let them work. Show them that you have value as a patient. So what's the homework? Just a small backup and sum up so that you remember that and increase your chances of getting good care. It has been proven that medical literacy improves the outcomes. Unfortunately, we have no university of patients where we would be taught to do everything well. Thank you for having comment. I am ready to answer your questions. I hope that we will get assistance with the microphones. Please raise your hand and you will be given a microphone. I once came to a general practitioner and I asked to be referred to a colonoscopy, and she asked, what are your indications? I told no particular indications, it's just that I'm older than 50 years old and I want to get a check. She says there are no indications. In that case, we cannot get a referral. So I had to explain to her that my husband died in 6 months of colon cancer. As far as I know, colonoscopy can be prescribed after 50 years of age. First, one should make the fecal occult blood test, and then, if it is positive, you get a referral. I read the checkup list, and colonoscopy is not included there. Well, maybe you could wait 1 or 2 years. And according to the modern recommendations, I think that you will get a colonoscopy. My husband died in 6 months. He had no symptoms at all. So should I insist, or how should I proceed? Of course you should insist. Well, there is an option of paying and making it on the private market. If it is something that is a big concern to you, the decision is taken by the doctor. If it is part of the checkup program, they are obliged to make it to you after a certain age. Good afternoon. I'm a doctor, so I came here to listen to what we are going to teach to doctors and patients. My first question is about the list of medicines that you showed. On 10th position, there is Mixitol. If we take the session of this year's assembly about elderly patients, then people who determine the treatment of elderly patients and issue recommendations on their treatment are including this medicine there. So I would like you to voice that. Second point, if we take all the booths present here at the assembly, all the stands, and our current Prime Minister, who was an IT specialist before, then we can make a conclusion that all the medicine is focusing on digitalization and putting doctors away from patients. So saying that doctor is attentive and communicates with the patient is not something that will persist. Okay, let us start with Mixidol. I don't want to conflict with anyone, but the studies that I found do not look convincing. Indeed, we have a lot of medicines with doubtful efficiency that are part of the essential drug list in Moscow and in Russia. It's quite questionable, but I think it's a matter of politics. The speaker is off mic. I understand that there are also Russian recommendations, and sometimes the doctors are obliged to prescribe some medicines with unproved efficiency because they are part of treatment protocols that concerns strokes and nootrops. Doctors are skeptical about them, but they are purchased in big quantities by hospitals. I'm now talking as a journalist, not as a doctor, about international practice. Some drugs are not recognized by the international community and are not part of clinical recommendations there. And our recommendations do not always respond to that, and our doctors are hostages of this situation.
Было сверху спущено отчасти. Но мне кажется, хороший врач.
They may not want to prescribe this medicine, but they are obliged to. But I think that a good, educated doctor will read randomized controlled trials and will see what international practice says about that, because unfortunately studies in Russian are not always reliable, and in Russian journals half of journal is just advertising, and you may have an article about the medicine and next to it the ad of this medicine. So not always do our doctors recommend what should be recommended, as I see it. Speaking about digitalization, I can say that yes, there is this issue. There is the issue of staff shortage in Russia. There are not enough doctors, there are a lot of patients, and that needs to be regulated. Of course, some points related to digitalization are good, because it's good to have a good interface, and it's good when it's possible to sign up for a medical visit online. It's good that some operations are automated. However, I think that this is an concerning trend, and a subsequent reform of healthcare will help. So far, I have a lot of questions towards the efficiency of that, because it would be strange to expect that all the robots will be replacing doctors, because so far such a robot hasn't been invented. Good afternoon. Thank you for your presentation. I was a bit surprised with the beginning of lecture. You posted a picture of Andrei Pavlenko. I think that it is in contradiction with the subject of the lecture. That's a tragic event. 1 month before the day of fighting cancer, he died. Why did you start with it? Well, first of all, I wanted to attract attention to this story of once again. Andrei Pavlenko did a lot to popularize the patient literacy over the last 2 years. And my metaphor was maybe quite ambiguous about how a doctor would try to recover. I wanted to say that we all have a common enemy. We may have very good medicine, but still it doesn't always help. Or we have a perfect access to medicine, like in case of Andrei, and this will not guarantee the recovery. And if there is misunderstanding between the doctor and the patient, that will make the situation even worse, because in Andrei's case, there was good access, but still, unfortunately, he died. I think that Andrei Pavlenko is an example of a doctor who made a lot to make the communication between doctors and patients simpler. He received a lot of messages from patients who said that they have started trusting more to the doctors after what he explained. So we should remember his story when asking ourselves whether we should conflict with the doctor. We are still in the same boat, and we have one common enemy. Our medicine in the 21st century is good, but there are still some issues unresolved. Good afternoon. Thank you. Unfortunately, I came a bit late, and maybe you have already said that. I have a question about this medical checkup or regular checkups. Is it possible to get them free of charge in public institution, and if yes, how? Well, many people blame checkups. They say that many important tests are not included there. But I think that our checkup program is very good. It is small, but that's how it should be. There is no point in getting all the examinations to identify all diseases at early stage. More often we get false positive results, and we start to get stressed about the diseases. There is the screening of 3 cancers that we can screen. There are minimum diagnostic tests regarding gynecology or diseases specific for smokers. Of course, it all depends on age and way of life, but this is sufficient. If your polyclinic is good, there is no need to go abroad for whole body examinations, because this can serve as a pretext to provide some medical services to a person who is healthy. So our checkup system is quite good, and you can use it. So I should go to the general practitioner and say that I want a test. Well, you may do it once per 3 years, so you should make sure that it's the year of your age category. But actually, even if it's not the year of your age category, you can still make a smaller checkup. Thank you. May I just ask a very small question? Unfortunately, we have to finish. You can ask it to me directly. Thanks to everyone. Goodbye.